Okay, everyone. Welcome to the 2012 and 2013 seasonal influenza training. I know most health departments have their vaccine and are eager to start giving those out. So we moved up the training it was scheduled originally on the 28th, and so since all the information has been made available as far as the protocols, then we've moved it up to today. I hope that hasn't inconvenienced anyone, and it makes it much better for you to get the information so that you could go ahead and start administering those vaccines. The training today is very similar to the one last year. If you attended last year's training, it shouldn't be very long, and it should be fairly simple and concise. And if you printed out the PowerPoint, which we made available to the health department directors, I think maybe on Friday, all the documents are now located on our local health web page also. And so you'll notice that the PowerPoint training is not much different than the one last year, but there are a few changes, and so I'll emphasize those. So we can go ahead and get started. If you would hold your questions until at the end, and perhaps if you do have questions, they'll be answered during the time we're going through the PowerPoint. Okay? Okay. Emma, do I thought I should just hit the I have to do the mouse thing. Okay. That can happen. Okay. For the most part, the training today is going to be for those health departments that are providing the seasonal influenza vaccinations and reporting them through the patient encounter reporting system. So if you are not reporting through the patient encounter reporting system, this would be good information about vaccinations, but for the most part, it's all about reporting it in the system and charging for them. So it's for those who will be given VFC vaccine and or private purchased influenza vaccine. This slide is a copy, or the top half, of the vaccine administration form. It's pretty much like it was last year. We've changed the dates for the VIS. Is one of about the only changes that we've made on this document. It is out there in English and in Spanish. Okay, collecting and reporting the patient information. Now, I'll leave this out by saying this is a reminder that it would be very important to collect income information if you're doing self-pay VFC eligible patients and charging the administration on the sliding fee schedule, or if you're doing those that are other than VFC patients and you're also providing the vaccine and the administration on the sliding fee schedule. If the patient does not complete the household and income fields on the document, and I'm referring to this here particular flu administration document, then you may enter one in the household, and then you can leave annual income, that field blank, and enter the income assessed date as the date of service. And as you know in Portal, that it would show up on the label with an NA, and then the system would default to 100% pay. A lot of people do the flu shots as a fixed pool charge, so we'll have some discussion here on that. You may use a fixed pool charge if it's self-paid patients for which your agency has purchased the private stock vaccine, and we'll be administering those to those patients. When the fixed pool charge is flagged, that rate will be assessed to the patient regardless of the amount of income listed for the patient. In other words, if the patient has an income, maybe they've had a previous service and they have an income out there, if you flag fixed pool charge, it's still going to charge the full amount according to what's on the 501 service file for that fixed amount field to that patient, regardless of what is listed in their income. Providing the influenza vaccination at the fixed pool charge to the self-pay patient, the service is charged at the fixed pool charge rate, which I just said, through the service file, unless otherwise authorized by DPH. And that would be where maybe your agency has requested a different rate and got that rate approved. The fixed pool charge may be used for reporting self-pay VFC eligible patients. However, they cannot be charged more than $14.17 for the administration. DPH has approved an override rate rounded to 14. With that being said, what we're saying there is if you choose to let the 1417 slide on the administration code for that VFC patient, that's fine. If you want to do that VFC self-pay patient at the fixed pool charge, you may override in the charge category field column with $14 without asking approval. But this is specific to those self-pay VFC eligible patients. And information from the CDC VFC policy says, VFC enrolled providers may not charge a vaccine administration fee to a VFC entitled child that exceeded the regional administration fee cap per dose of vaccine. And our rate for our state is $14.17. Also, for established VFC patients and other VFC eligible patients that the provider chooses to immunize, VFC immunizations cannot be denied due to the inability to pay an administration fee. So keep that in mind also. If the patient has had an income assessed in the past 6 months, there is no requirement to reassess the income. So you don't have to collect it again. And also, you will need to assure that if you change the income in the system, it does not pose issues for established patients who are participating in other local health department or DPH programs. One of those that comes to mind would be if the WIC patient maybe has been certified to the WIC program based on income, and it's within its certification period, and then you change the income here with the influenza vaccination. That could, changing that income can impact that WIC eligibility potentially. So just be real careful. Most other things that you could change, it wouldn't really affect. You would just do the income assessment again. Say they had a family planning service and you 2 months ago or something, or 3, and you took income. And then today when you're doing the flu shot, you took another income. Or they didn't list income. And then it went to NA, charged at 100%. And then it left it there. Then you would probably need to reassess their income when they come back in for their next family planning visit. Just keeping that in mind if those incomes are changed. If the patient only receives a flu shot, then an evaluation and measurement visit cannot be reported. And that's part of the NCCI edits that we talked about back from January of 2011. This has not changed. It is still the same. However, if the patient gets a different service in addition to the flu shot, then you can report the other problem-focused E&M with the 25 modifier and the diagnosis code for what that office visit would be for. And I have the example saying the patient presenting for family planning birth control supplies and gets the flu shot. The flu shot would have the administration code for the flu and then the vaccine. And then For the family planning visit, you would have the level of E&M with the 25 modifier, and the diagnosis code for that E&M would be the V25 code for family planning. Okay, the bottom half of the influenza administration form is very similar. However, we have added a couple of, or moved something around. We've moved the 90654, the intradermal, over with the others. It was on the right-hand side. Now we've moved it over because it is covered by Medicaid, preventive Medicaid, and Sharon has provided information to the MCOs that hadn't heard back from them yet, so we're not sure, but it should be covering that. Passport, we have asked them about covering this vaccine, and they are still looking into it with their management. They have not got back with us yet. So the only one I know for sure is preventive. However, that should translate over into the MCOs. Another code that we've added this time is under the Medicare only, and that is the Q2034 AgriFlu. I don't know if anybody purchases it. When I looked at it, it looked like it was for specialty type clinics and things like that where it was given. So it may not be anything that local health departments will be purchasing. I'd like to say here also that with Medicare patients, do not report the 90658. If you're going to provide an injectable vaccine with preservative, then you have to use one of these Q codes that with the particular brand of that vaccine. These. Okay, these codes. So I know last year we had a few issues with people reporting 90658 instead of the Q codes, and they were all denied by Medicare. And then we also had some that reported the 90658 and the Q code, which they also got denials from Medicare. So Medicare does not recognize 90658, so do not report it to them. Now, with that being said, they do recognize all the other codes, the 90654, 555, 5657, 660, and 662. Those will be reported. But 90658, not reported. You would use the Q codes. Okay, this slide, people should be familiar with. I've used it the last couple years to identify the codes and then their description, the rate in the 501 service file, the Medicare rate, the Medicaid rate, and the passport rate for those pay plans that cover these vaccines. I took off Passport Advantage because it is not applicable anymore. So you can see that a couple of the codes or flu vaccines have increased just a little bit, and they are in red. And you also notice that with Medicare, we only have the rates through the end of the month, and they have not published the rates starting September 1st. Sometimes they get those two out the day before, and sometimes they don't come to sometime after September the 1st. But we'll be watching for them, and as soon as those rates, we are able to get those, we will be updating this here document, and you can find those revisions out on our local health web page. And I will have that in red on that document. Any changes that we make will be put in red out on our local health web page. And this is just this other part, the second part or the bottom part of that same rates document. It also includes the pneumonia on this. Okay? When reporting the G0008 administration code, the 80,000 pseudo procedure code will not be needed. When reporting the other vaccine administration codes, the 90460, the 471, or the 473, the 80,000 code will be needed. If ever you're using, and I can't remember, it seemed like there may have been a scenario, but it doesn't come to me exactly what happened. But if you use the G0008 and they're getting additional services at your agency, and it won't take it, go ahead and try to do it with an 80,000. I think there's some little quirky things in there with hard code edits on some things that causes that not to work every time. So try that first, and if it doesn't work, then contact us. If you're billing Medicare or insurance companies, use the administration codes required by those third parties. So that'll be your agency's responsibility to know or to check with those insurances that you deal with to know what codes they'll accept. A lot of them will go ahead and accept the Medicare code, which is the G0008, and the 90460 or 471. They don't have an issue as long as the vaccine administration code works for a vaccine or the flu directly. Some may not want that Medicare code. You all would know more about that at this point than I do, since you're dealing with the insurance companies. When coding by component, you should review the VIS form thoroughly with the patient, parent, or legal representative, discuss the risks, benefits, and side effects, answer any questions they may have, and then document on the form that you've counseled per component. There is a little space that says notes at the bottom of the page where you're documenting your CPT code for the service, and you can write on there counsel per component if you're using the flu administration document. If your local health department wants to request a different rate for the flu vaccine administration than those that are in the system, then you would send your request to the local health help desk. And requests for influenza administration for self-pay patients should be no less than $18 if your agency is billing Medicaid. We get $18.40 from Medicaid, therefore we've rounded to 18. We will not, if you're billing Medicaid for those services, we will not approve administration for less than 18. And also, I put the reminder again, the VFC eligible patients cannot be charged more than $14.17 for immunization. So always keep that in mind for those. On this page is where I have a little bit of something different. DPH will have listed on the 501 service file the highest rate per CDC private sector dose, and we try to keep that up to date and as it changes. And so we'll be watching, because we know some things may change, and we know, like I said, that the Medicare will be changing for some things. Health departments may choose to override private dose influenza vaccine with a lesser rate than what's in that 501 service file for that CPT code without written approval from DPH. Now this is different, a little different than what we've done before. The reason we say with a lesser rate is because some people may purchase a vaccine from a manufacturer that is the lesser amount. Also, some may want to give overall at a specific rate, and we want you to make sure you charge the rate for the administration as we've indicated. So you might want something lesser. So let's go to the next PowerPoint to see this. Okay, in this example, the health department wants to charge $25, and we're going to be doing it as a fixed full charge. So I'm using administration code 90471 or the G code. The fixed pool charge rate is $22. Then we're using 90658 NV for the vaccine because your agency has purchased it. And so we're overriding it with $3 to get $25. So if you look on the, right below there where it says the PEF entry, we got fixed pool charge, yes. We've got income and number in the household, though, in there. So then we've got the 80,000 code to report this one. And you see in the charge column, we put $3. That would be the only thing you have to do as far as override. Then your bill screen would come up. So the charge for the service was $22 for the administration on the fixed pool and $3 for the actual vaccine. And you see here, it's in the not sliding eligible, as we have marked fixed pool charge. So the visit was $25. The balance for the patient was $25, and they don't have a past due balance out there, so the balance due today, $25. So that would be how you would report that in that kind of way with a fixed pool charge, by just overriding the actual vaccine with a different rate. Your agency director will make a decision on that particular amount, how much they're going to charge for that. And if you have any questions or need further explanation with that, I'm be glad to answer any questions. So you can send your questions to the help desk, and we'll be able to help you out there. Another example that I have, and I'll have to tell you, I've made an error on this a little bit, so I'll get right to that. On the administration, 90471 does not have a slide of $18. It has a slide of $14.17 because we use it also for VFC reporting when we're not doing it by component. So just draw a line through that, 90471, because that does not slide at 18. So the G code would slide at 18. And then we got the 90658 at $12 in the slide. Now, I've done a little percentage pay here with that same patient that had 4 in the household and $30,000, and I've been able to get this from bridge registration, which I have access to now still, and I can show poverty level and percent pay. So with that, the percent pay is 10% for 4 in a household, $30,000. So you would enter your encounter, no fixed pool charge or anything marked, nothing marked. You just enter it right in. Don't have to change anything. And then your bill screen would look like this. There would be a charge, total charge, and then the sliding fee eligible charge. And then, so with the percentage pay, the visit was $30. The agency assumed $27. And the patient's balance was $3. So then it should be $3 due in this in the due field. So and it would show up. I had on my test patient I had a money amount in there, so I blanked it out, but it would be $3 on the slide for this one. Now, if you did do a slide with the 90471 with the 90658 NV, it would slide on 1417, and then their charge down here, percentage out with 10% pay, would have been an overall charge of about $2.62 for that patient. This is kind of the end of my slide presentation. I do want to say, I'm going to go back. Whoop. Oh, when I talk about the health department being able to go ahead within the agency by the director to have a lesser rate for the vaccine, if your agency has a rate that is higher than what is listed for that vaccine code, that flu vaccine code in the 501, please contact us. We want to know. One, it may be that rates have changed and we've not got that information yet, or something in the ordering process is to cause those to be higher. So please contact us for ones that are above the amount that's listed in the service file. Okay. Is there any questions? Okay. Well, I hope that we've made it a little bit easier for you all this year, especially about requesting, since you don't have to ask if you want to override with the $14 for the fixable for the self-paid VFC patients, and also for the lesser amount on the vaccine for those that you private purchased vaccine. And then that would make it easier for you. However, like I said, if you want us to go over it with you and help you out with how that would be documented or reported, is if you are overriding those particular vaccine codes, we'll be glad to help you out. Just send the question to the help desk. The only time we don't really will not do a whole lot of adjustments or approvals will be with the administration rate, and I've indicated all those different reasons within the training. And I'll reiterate that all the documents are out there on our local health webpage under upcoming trainings, and if we do make any changes, especially in rates, I think that probably has possibility soon, then we will have them out there with the revised date, and those will be in red. If you have any questions, since I haven't had a question, if you have any questions at any point in time during flu season, just please let us know at our help desk. Thank you for participating in the training today.